After you have experienced a panic attack or two, you can become hypervigilant, in which you become especially wary of situations or sensations that might signify a forthcoming panic attack. Unfortunately, this hypervigilance is counterproductive. It pathologizes normal variations in how your body feels, and it can prompt you to avoid certain places and experiences, which imbues them with more fear. Such hypervigilance then actually increases the likelihood of a future panic attack while ensuring that you survive in a basic evolutionary sense.
Can you provide an example of how this process works?
Sure. Let's say that you're walking down the street and you notice some tightness in your chest. Most likely this is a normal response to something happening in your life or immediate experience. You might have some stress-related muscle tension, or you might be carrying a bag or suitcase awkwardly. Perhaps you've started working out again recently or really pushed yourself in the gym. While this is the cause of the muscle tension, it is not immediately apparent. As a result, you think that it is really strange and potentially worrisome. Based on these thoughts, you activate the fight or flight response associated with fear. Your body physiology begins to change. While these changes are ideally suited to help you respond to the perceived threat, you experience them as threatening and disastrous. For example, your heart starts beating more quickly and strongly in order to distribute blood more effectively to your major muscle groups. Very natural and appropriate if you're going to be fighting something or running away. However, you believe this cardiac change to signify that something is wrong with your heart. Your respiration rate increases and the bronchioles in your lungs dilate for the purpose of better oxygenating your blood supply. What a wonderful way to energize and sustain emergency action. However, you experience this hyperventilation as alarming and smothering. As you can continue to experience the normal physiology associated with fear, you misinterpret what these changes mean, which worsens the reaction until it reaches the point of panic.
How do I stop having panic attacks?
Fortunately, panic disorder is easily treatable. Research indicates that the most effective treatment for panic is cognitive behavioral therapy, more effective than other psychotherapies and even better than medication over the long term. Here's some more good news. CBT for panic disorder is relatively short. Structured therapy takes anywhere from 12 to 25 sessions, depending on its severity and presence of other problems. Some people experience relief even after just 1 or 2 visits.
What about medication?
Scientific research suggests that CBT, medication, and the combination of the two are all effective in providing immediate relief from panic disorder. Medication seems to have a more significant impact in the short term, presumably by directly inhibiting or counteracting the fight or flight response. Over time, however, medication seems to be associated with a higher degree of relapse. CBT, in contrast, provides more sustained improvement over the long term with less likelihood of re-experiencing panic attacks.
What does CBT for panic disorder involve?
Cognitive behavioral therapy for panic disorder typically involves 4 or 5 components. First, you receive important basic information, such as the fact that no one has ever died from a panic attack, despite what it feels like. Second, you will learn the panic attack profile for yourself. You will discover your particular triggers, automatic thoughts, and your physical experience of fear. Third, you will learn how to identify and correct the misperceptions that can trigger or intensify the fight or flight response. Fourth, you will be trained in various relaxation methods designed to counteract the fight or flight response. Finally, you might also be guided in learning how to experience relaxation in response to situations or sensations that you previously considered to be threatening. Called exposure, this process is helpful if you are especially prone to panic, have developed agoraphobia, or experienced panic attacks during sleep.
What are some common misconceptions about panic?
First, despite how a panic attack feels, it will not kill you. No one has ever died from a panic attack. Let me say that again. No one has ever died from a panic attack. Second, there is nothing wrong with feeling afraid or anxious. It is a very natural and normal response to how you are thinking in response to a particular situation or somatic sensation. In fact, we need to have a moderate level of anxiety in order to live a successful life, by going to work, paying bills, caring for our family, and so on. Third, panic is not best treated by therapy that explores childhood experiences or past trauma. While our history contributes significantly to whom we are today, it cannot be changed. The past is over. The present, however, is amenable to change. As a result, we need to address how we are experiencing the world today through our thoughts, emotions, and behaviors in order to provide relief from excessive anxiety and panic.
Any last words of advice?
It is important to know that panic itself is not dangerous and it is very amenable to treatment. In fact, this is one area in which cognitive behavioral therapy really shines. So if you're interested in learning more about panic disorder, please check out other areas of our website, www.cognitivetherapinyc.com, or contact the American Institute for Cognitive Therapy if you'd like to set up an appointment with one of our highly qualified clinicians.